Axial skeleton. I have the frontal bone. I have the parietal bone. There's one on the left and the right side. I have over here towards the back the occipital bone. I have an occipital protuberance. Right here is a site for muscle attachment. With the temporal bone, I have the external acoustic meatus. I have the temporal mandibular joint. I have the mastoid process, which is a little hard to see right under there. I have the styloid process, which is also a little bit harder to see. And I have the squamous part, which is right up here near the squamous suture. Internally, we have the petrous part, which allows for sensory reception, hearing, and balance. On the front part, I have the sphenoid bone. I also have the superior orbital fissure, which allows for cranial nerves 3, 4, and 6, and part of cranial nerve number 5 to pass through. Internally, we have a lesser wing, a greater wing, an optic canal, and the optic canal allows cranial nerve number 2, the optic nerve, as well as ophthalmic arteries to pass through. I also have inside the sella turcica, which is where the pituitary gland sits. The ethmoid bone, right in there, it's also hard to see. Inside of the ethmoid bone, we have the crystal galley, which is an attachment site for the falx cerebri and also for dural membrane folds. I also have the cribriform plate, which allows filaments for the olfactory nerves to pass through. There are 4 sutures. I have the coronal suture, which goes right across the front. I have the sagittal suture, which goes down the middle, left and right side. On the back, we have the lambdoid suture, right across. And I also have the squamous suture, which goes right around the temporal bone. For facial bones, there are 7. We have the maxilla here. I have the alveolar processes, which are right above and then right below. I have the zygomatic bone, which is here. I have the ethmoid bone, the vomer, and the inferior nasal concha, which are all internally and hard to see based off of this model. I have the mandible, which is down here. With the mandible, we have the body there. I have the angle of the mandible. I have the ramus. It's right up there. It's kind of hard to see. I have the mandibular condyle. I have the mandibular notch right under there. And we have the coronoid process right up on that side. We have the vertebral column, which is an S shape. We'll start with the cervical vertebrae. There are 7 cervical vertebrae. The first part that we'll look at is the atlas, which is way up here. With the atlas, it allows us to move our head in a fashion that says yes or no. Yes or no. Okay. The unique part about the atlas is that it allows for foramen to go through it. Foramens allow for arteries and veins to go through and to reach vital places. We have the thoracic vertebrae, and there are 12 of those. Okay, thoracic vertebrae. I have the spinous process, which is the long part that sticks out the back. We have the transverse process, a little hard to see, but I'll show you one right here. It kind of sticks out to the side like little wings. Kind of sticks out to the side, okay? I have intervertebral foramen. The intervertebral foramen allow for the nerves to pass through. I have the body of the vertebrae, which is this circular part that you see all the way up. Okay, and then the intervertebral disc are these little pieces of material right in between each vertebrae. So it goes all the way up. There's a lumbar vertebrae. Okay, there are 5 lumbar vertebrae. Their spinous process is a little bit shorter. And then I have a sacrum. The sacrum consists of 5 fused vertebrae. And then we have our coccyx, which is kind of curved. It's like a little tail. Curves right under there. Okay? Right there. And then we have our sternum. Okay, with the sternum, we have the body here. We have the manubrium, this part up here. We have our xiphoid process, which is at this little tip. This is where we do CPR, right there. Make sure you don't break it off. And then we have our jugular notch, this area right here. And then we have our ribs. Now, for ribs, the first 7 ribs are considered our true ribs. They're connected to our sternum. So we have 1, 2, 3, 4, 5, 6, 7. And you see right there, 7 ribs connected to our sternum. And then we have ribs 8 through 12, which are considered our false ribs. Ribs 8 through 12 are connected on the inner part by cartilage extending from rib number 7. They come out and they're all connected to rib number 7. And there's 4 ribs 8 through 12. They also connect all the way around to the back, to the vertebral column. And then we have ribs 11 and 12, which are considered our false ribs. These ribs aren't connected at all to the sternum. That's why they're considered false. They're kind of floating in the air off by their own. 1 and 2. 2 false ribs, 1 on each side. Okay? And then we have the head. It's kind of hard to see, but let me see. I can probably use this. I have the head. It's hard to see it. Okay, let's go right here. This is like a head of the rib right there. That's right there at the vertebral column. Underneath it we have the tubercle. There is the neck of the rib. Okay. And they articulate right here. It's hard to see. Axial skeleton. Axial skeleton.